Antipsychotic drugs. Now today we'll have a look at the drugs. These are categorized into first generation with low potency, first generation with high potency. Low potency are chlorpromazine and thioridazine. Higher potency first generation drug are flufenazine, haloperidol, loxapine, molindone, perfenazine, pimozide, prochlorperazine, thiazine, trifluperazine. Now comes the second generation antipsychotic. They are aripiprazole, acinapine, brexpiprazole, cariprazine, clozapine, iloperidone, lurasidone, olanzapine, paliperidone, pimavanserin, quetiapine, risperidone, ziprasidone. Now these were the agents used for antipsychotic. First we'll see what is schizophrenia. It is a type of chronic psychosis which is characterized what are its symptoms: delusions, hallucinations, often in the form of voices, and it will make thought disturbances. The onset is often during late adolescence or early adulthood. It occurs in 1% of the population and is a chronic disabling disorder. Now, schizophrenia has a strong genetic component and probably reflects some fundamental development and biochemical abnormality too. So, it is a dysfunction of mesolimbic or mesocortical dopaminergic neuronal pathway. So, we'll focus here on its treatment. Now, antipsychotic drugs. The drugs usually are divided into first and second generations. First is divided into low and higher potency drugs. This classification does not indicate any clinical effectiveness, but rather specific affinity for D2 receptor, which will affect the adverse effects of the drug profile. Now, first generation antipsychotics. These are also called conventional. These are competitive inhibitors, but their effect will reflect competitive blockade of dopamine receptors. First generation are more likely to be associated with movement disorders such as extrapyramidal symptoms, EPS. Particularly drug that binds tightly to dopaminergic neuroreceptors such as haloperidol. Movement disorders are somewhat less likely with medication that bind less potently such as chlorpromazine. Now, second generation antipsychotics. Second generation antipsychotics are also called atypical antipsychotics. They have lower incidence of EPS extrapyramidal symptoms than first generation, but they are associated with higher metabolic adverse effects that are diabetes, hypercholesterolemia, and weight gain. Now, a second generation will act on both serotonin and dopamine receptor blockade. Drug selection. Second generation drugs are generally used as first line therapy for schizophrenia to minimize the risk of EPS, which is associated with first generation drugs. The second generation exhibit efficacy that is equivalent to occasionally exceeds that of first generation. Differences in therapeutic efficacy among second generation have not been established. Now, refractory patients, approximately 10 to 20% with schizophrenia will have insufficient response to first and second generation antipsychotics. For these patients, clozapine has shown effective antipsychotic with minimal risk of EPS. Clozapine can produce bone marrow suppression, seizure, CVS effects such as orthostasis, the risk of agranulocytosis. Now, mechanism of action. Now, dopamine antagonism. The drugs are acting on dopamine receptor to block it. Usually, the normal process is dopamine is bind into the vesicle, which is then released into the synaptic cleft. The dopamine particles, dopamine neurotransmitter will attach to D2 receptor and produce effect. Now, when you take antipsychotic drugs, they are similar to dopamine and come and bind at the dopamine receptor. Thus, they will inhibit the binding of dopamine, and this is how they will decrease the intracellular response. Now, mechanism of serotonin blocking activity, which is exhibited by second generation, especially clozapine, It has high affinity for D1, D4 and 5-HT2 muscarinic and alpha adrenergic receptors. Also weak D2. Risperidone, it will block 5-HT2A greater extent than D2. Olanzapine, the second generation antipsychotic, aripiprazole, brexpiprazole, cariprazine, they are partial agonists at T2 and 5-HT1A receptors. Now you can see here clozapine, chlorpromazine, haloperidol. This is lower affinity and this is higher affinity for D2 receptors. Now for D1, clozapine has the highest and the rest have low affinity. For D2, haloperidol has the highest affinity. Now actions. The clinical effects of antipsychotic drugs reflect a blockade at dopamine or serotonin receptors. They will block cholinergic, adrenergic and histaminic receptors too. You can see here cholinergic, adrenergic, dopamine, serotonin and histamine. These antipsychotic drugs will block all of them, particularly the blockade of muscarinic receptors, particularly with thioridazine and chlorpromazine. For alpha receptor, it is with chlorpromazine. Dopamine, it is with haloperidol, fluphenazine, thiothexine. Serotonin is with clozapine. Histamine is with clozapine and chlorpromazine. Now you can see chlorpromazine, chlorpromazine and chlorpromazine for 3, and clozapine is mainly for these two.